Welcome to TNT. We're going to talk today about grief and health. Most people going through grief suffer from health challenges and don't quite understand the correlation between grief and health. And I have written extensively in my book about this, and I do hope you pick a copy for yourself or somebody that you know who could benefit from this. It's Widows Are Warriors, A Walk Through the Wilderness of Widowhood. Quite frankly, if it's not a wilderness, I don't know what it is, because you just don't know what's coming out from the next blind spot. You don't know how you're going to deal with it. You don't know how much peace and quiet you're going to have. Everything is unpredictable and unanticipated and probably unencountered prior to your loss. So Megan right here has a few questions from my book for me, and we can talk about some of the issues of grief and health.
Well, today we're talking about broken heart syndrome, and we use broken heart in a figurative way all the time, especially a relationship breakup, something like that. But when it comes to dealing with loss, it's actually a literal syndrome. So what is broken heart syndrome?
So let's go back to your analogy of having a broken heart when you have a broken relationship. The loss of a loved one is akin to that loss in many ways, right? Because you have lost a loved one. You have, in some senses of the word at least, a broken relationship. Not by your own choice, not by the choice of the person who is not with you anymore, but there is a chasm between you and the person you love that you can't find a way to breach and restore that lost relationship. So there is a lot of sadness and the figurative brokenheartedness over this loss. However, it is not uncommon to find people who've lost a spouse who get a heart attack, suffer from a stroke. They feel like they're losing their minds. They suffer from chest pains with or without any cardiac evidence. And this is because your grief is actually causing changes in your body. It messes up your hormone patterns, and those hormones also direct the functioning of vital organs in your body. Your grief can consume you so much that oftentimes your body decides to neglect all the other organs because it's so focused on helping you through your grief. Broken heart syndrome is literally left ventricular failure, which is another form of heart attack.
Right. What you've written here is when a patient's heart breaks, the main pumping chamber, the left ventricle, weakens, leading to pain and shortness of breath. The condition is reversible and temporary, but can lead to complications similar to those after a heart attack. Expert thinks it's caused by a flood of hormones, such as adrenaline, produced during a stressful situation that stuns the heart.
Yes, and now you would think that that stressful situation that stuns the heart only happens in the traumatic moment. The reality is you have many such moments throughout the time of you grieving. Flashbacks are notorious for pumping your adrenaline through the roof. So you could be sitting there and something triggers you and you go through a full-blown panic attack or anxiety attack. And it has to do with either you reliving the moment or you comprehending the reality of your loss. And in this moment, you're thinking, I can't do this. Your body goes into fight or flight. It surges all these hormones through your body. There is only this much of power surges your electrical circuit can handle
Right.
in your house before something fries. Totally.
Mm.
It's the same concept with your heart. You're constantly hitting it with these adrenaline surges, with anxiety attacks, with panic attacks, with flashbacks, with nightmares, with all of these. And when that happens repeatedly, it weakens the left ventricle, your pumping chamber, because it just has to work this hard every time you have an adrenaline surge.
Right.
So it's very similar to a power surge.
Mm.
And then ultimately that destroys something.
Right.
And broken heart syndrome is a power surge. It's your grief or anxiety that causes an adrenaline rush
Mm.
that ultimately will cause in the breakdown of your left ventricle, resulting in, quote unquote, a broken heart, which gets you in the hospital.
Right. And cortisol plays a large role in this. I know even beyond just the heart, you experienced a lot of physical ailments because intense grief takes a tremendous toll on even your ligaments and your muscles, and you had a really bad shoulder tear that was
Yep.
you basically were worn
So,
down.
we've talked about all the hormones that surge and go out of balance. There's the stress hormone called cortisol, which is secreted by your adrenal cortex. Now, think about it when you're constantly in a stressful situation, even in your sleep, you're in a stressful situation because your subconscious is processing your grief and your loss while your body is trying to sleep.
Mm.
So you're not really restful, right? So your adrenals are still pumping cortisol, pumping cortisol, pumping cortisol to cope with the stressful situation, which your body feels like you need to have your A game on so that you can deal with it. So the cortisol just is through the roof. Two things happen is one is your adrenal after a while says, okay, I'm done responding to this. I am exhausted. I'm tired of all this constant stress in this person's life. I'm going to shut down. And that's called adrenal fatigue.
Mm.
And so then your body does not produce the balance of hormones you need to respond to a stressful situation. And cortisol being in such high levels in your body affects every system in your body. In fact, I've written about that in one of my chapters on cortisol. And let's go system by system. I think it's right after
21.
this one. Yeah. So let's go system by system. What do I say on any particular organ system? And I'll elaborate on that.
Inhibits insulin from shuttling glucose into cells.
There you go. So if cortisol prevents the insulin from going into the cells, guess what's floating around in your body? High levels of sugar, which insulin would need to capture that and pull it away from your bloodstream so that it doesn't go and engage in all your vital organs, including your brain.
So it puts you at high risk for diabetes.
So you have a high risk for diabetes.
Interferes with T cell production and function.
That's your immune system. Your T cells are your fighter cells.
Right.
So production and functioning of your fighter cells is now being hampered by cortisol. So what does that mean? That means your immune system's down, which means you get your coughs and your colds and your fevers, and you just don't feel good all the time. And everyone thinks, she's just so sad all the time. She just complains that she doesn't feel good. Well, it is your body that is saying to you, I'm focusing on dealing with the stress, so I'm sorry, I can't help you fight this little bug that your neighbor's kid had, and now it's taken you out.
Right. Inhibits the uptake of amino acids into the muscle cells, making it almost impossible to fuel muscle cells when cortisol levels are too high.
That is why exercising is difficult. So if you can even just walk, but you can't do any intense exercise because your muscles are exhausted and you've done nothing. Your muscles are exhausted because you don't have the amino acids, which is the diet of your muscles. So if your muscles aren't being fed, they're not going to work for you. They're not going to help you do this intense workout.
Right.
And if you try to do too much of that, your muscle will start producing lactic acid, which causes muscle pains. So you ache a lot from doing little or nothing.
And it's a vicious cycle because then you don't want to move.
Then you do less.
Right.
Yes.
Increase in gastric acid production and decreased blood flow to the GI tract.
So increase in gastric acid production. Yes, we need gastric acids to digest our food, but if there's too much acid, you develop ulcers, you develop heartburn, you develop GERD, and those can be very debilitating, painful conditions. And it's not just you complaining about a stomachache.
Right.
It's the cortisol level in your body that has changed the composition of your stomach contents. And that's why you develop ulcers when you're stressed out.
And the last one, elevated cortisol can cause intense hunger and food cravings due to the metabolic derangement that occurs, which makes you prone to weight gain, which can play, obviously that's a physical, effect,
Right.
but mentally and emotionally, that's also a difficult thing to deal
Well,
with.
now you know why you eat when you're stressed out. One is it gives you something to do, you just like stuff your face with something. It gives you something to do. Food is comforting. So
Right.
you have a source of comfort, but the cortisol messes up with your hunger responses. And so you start misinterpreting messages to your brain as being hunger, and you don't understand why. I just ate. Why am I hungry again? Logically you can't be hungry. You just ate.
Right.
But it's the hunger responses in your brain that you can't ignore and you can't shut off. It's because the cortisol is messing with it. That's why you gain weight when you're stressed out.
Right. Right.
Cortisol will mess with you big time. I know that it made my hip joint so lack that I started having low back pains that I'd never had before in my life. And it's because the muscles weren't strong enough to hold my hip joint in place. And for the slightest thing, it would be out. And I'd have to get it readjusted just to be able to get rid of the low back pain. I had a massive tear, not once but twice in my right shoulder.
Right.
And it just wouldn't heal.
Right.
And every time I tried to do something, it tore again. I lost the use of my arm. It's because the cortisol levels were not allowing my muscles, my ligaments, my tendons, whatever, to heal. And because they weren't providing them the adequate nutrients. So, folks, if you think it's all in somebody's head and they just need to get over it, or they're just complaining about things I don't understand, why someone's always got aches and pains. I don't know why someone complains about chest pains. The reality is, it is, in fact, a physiological change in their body that's occurring because of the emotional problem that has brought on a chemical imbalance.
Right.
So, cortisol can be your friend when it's in balance and it helps you deal with stressful situations, but prolonged stress, cortisol will turn into your enemy. And you've got to do all it takes to keep it under balance. So I hope we were able to touch on some of the health issues that go with grief. And there will be more to come. There's just so much more to share with you. We just can't do it all right now. So stay tuned, subscribe to our channel TNT. And while we thank you for being here today in this episode on our grief series, we look forward to seeing you at our next video.